Welcome to the hormone update for men. This is something I'm recording for men and their physicians. I just want to kind of give you some updates. There's been a lot of information recently coming out very rapidly in the past decade on hormone replacement for men, andropause or male menopause or decreased testosterone in men, low T. And we know that these were originally started for sexual health problems with erectile dysfunction or lack of desire. And there's been a lot of drugs out there to kind of replace that that niche, such as the Viagra and Cialis and Levitra. But in reality, the low testosterone syndrome encompasses much more than just erectile dysfunction. There's certainly a link to erectile dysfunction. St. Louis University has the ADAM questionnaire, and that's something you can kind of Google, ADAM questionnaire, to figure out whether or not you can screen men for low testosterone just by asking them a few questions. And in July of 2016, the International Consensus Expert Opinion came out, published in the Mayo Clinic Proceedings, in July, and went over trying to answer some of the controversial issues regarding testosterone. Most of them were actually kind of either made up or a total misunderstanding of the literature. The literature is overwhelming. There are some studies that have been flawed that maybe have some contradiction, but in reality, contradictions are pretty much meaningless about things I'm going to talk about. I'm just going to give you kind of a summary. Testosterone deficiency is a well-identified medical condition that affects quality of life. And clearly, low testosterone leads to more obesity, diabetes, metabolic syndrome, and cardiovascular disease. There was a short-term bias that perhaps testosterone deficiency, if treated with testosterone, would lead to more heart attacks. In fact, some people have postulated that when men have heart disease, maybe their testosterone goes low, so they're not doing as much activity, and then they're sitting around more and have less heart attacks. It's really kind of nonsense. The reality is men with the lowest testosterone have the most heart disease. And numerous studies have shown benefit for men who had heart disease in terms of how much angina they had, how many events they had, and their quality of life. And it's also been shown that long-term supplementation with testosterone not only did not cause more heart attacks, but actually reduced the risk of cardiac mortality. Okay, so testosterone low is associated with more heart disease. Replacement is associated with less heart attacks and heart attack events. Sometimes people are thinking that they need to dig hard and discover the cause of testosterone deficiency. The International Consensus Panel says you don't need to look for a cause to justify using testosterone deficiency. If it's low, treat them. They also identify it's regardless of the age. There have been numerous studies lately on treating elderly male with testosterone. One of the biases and it's absurd, but I'm going to tell you what the bias is. Since testosterone decreases as we age, it is therefore normal aging. We shouldn't treat it. That would be as absurd as not treating hypertension, because hypertension obviously is more common in the elderly, or high cholesterol, or heart disease, or diabetes, because it occurs more often as you age. And in this article, they point out that is absurd not to treat it and call it normal aging. It is not normal aging. Okay, it's associated with more disease. There's another issue regarding certain insurance companies will only pay for testosterone deficiency if they hit a certain threshold. They got to check it first thing in the morning, check it a couple times. It's got to be under a certain threshold. And they point out there's not a threshold where you can reliably diagnose low testosterone. If the man is symptomatic and his testosterone is not in a normal range, not an ideal range, then treat him. Okay, because maybe some guy can survive on a testosterone level of 400, another guy might feel very sick from it, then treat him. We got to stop this bias that they got to be really, really bad in order to treat men with low testosterone. Goes on, any age, doesn't really matter. Global health concerns. So it's estimated that the United States will spend between $3 and $20 billion a year treating diseases that could have been prevented from treating testosterone deficiency. So if we treat testosterone deficiency, which is very inexpensive, and we treat the majority of men who have low testosterone with testosterone replacement, it's estimated it will save between $3 and $20 billion a year in the United States alone. Okay, it's a huge number. I was making a joke earlier that one of the PAs was saying the Blue Care Network won't pay for low testosterone in men because unless it's like extremely low. Well, they're figuring as they get older, they go on Medicare. And it's Medicare's problem. In reality, this is our problem as physicians. We need to identify this before it turns into a disease. So by the time the guy has diabetes, he's been low testosterone for years. There have been numerous studies showing that a man with adult onset diabetes has had low testosterone for years. We just missed it. We didn't screen for it. The evidence does not support increased risk of prostate cancer with testosterone therapy. And also, men who have had testosterone therapy that are cleared for several years can go safely on testosterone replacement. So the men with the lowest testosterone have the highest prostate cancers, and they have the most aggressive prostate cancers. And there's no evidence to suggest that testosterone therapy increases a man's risk of prostate cancer. So one thing we have to do as physicians is get over our bias of treating men with low testosterone with testosterone and calling it like normal aging. It's something like if we took everybody's blood pressure, let's say we took our patients off blood pressure medicines and measured everybody's blood pressure, and we say, well, we're going to only treat the middle, we're not going to treat the people that are in the middle 90%. Top 5% will treat, the bottom 5% will maybe treat with blood pressure elevating drugs or something, I don't know. The reality is that we don't really practice medicine this way, but that's kind of how the testosterone levels go. As you get older, your testosterone level drops. Does that mean it's normal? It does not. Okay, so low testosterone should be treated, and not treating it is as absurd as not treating high blood pressure, diabetes, heart disease, or cancer. And we have potential to save billions of dollars a year if we do this together. Thank you very much.